Hi, my name is Dr. David Walton. I'm the U.S. Global Malaria Coordinator. I'm here with you today to mark World Malaria Day. Of course, there's nothing really to celebrate about malaria. It's a deadly disease that kills one child every single minute in the world and has devastating effects on health systems and economies. But what is worth celebrating is the incredible amount of dedicated action that happens around the clock to end malaria once and for all. The U.S. President's Malaria Initiative is the U.S. government's largest program dedicated to fighting malaria, and together with our 30 partner countries, we're making progress. So what does progress really look like? In the face of new and worsening threats, it can be really challenging to identify, but it's definitely there. Did you know children in at least 20 countries across Africa will have access to the malaria vaccine this year? Over 2 million children have already been vaccinated against malaria, and this number is only set to increase in 2024. The important thing to recognize is not only that malaria is an important cause of death and illness, but it also predisposes children and pregnant women to other illnesses. For example, if you have malaria, you're more prone to anemia. If you have malaria, you're more prone to getting diarrheal disease. So vaccinating against malaria is not only important for malaria, but it also is helping partially protect against dying from those other illnesses, a critical advance in our progress for protecting pregnant women and especially children under 5. The U.S. President's Malaria Initiative is assisting countries with successful rollout of vaccines as part of each country's malaria control strategy, helping families understand the benefit of this life-saving vaccine and supporting health workers and making sure we capture the essential data around this historic rollout. Meanwhile, USAID is continuing to invest in research and development of new vaccines to ensure there's a robust pipeline of vaccines for the future. The malaria vaccine represents an incredible breakthrough, decades in the making, and is not surprising. When used with other trusted tools to prevent malaria, it is already saving lives, because investing in malaria is one of the best and most promising tools that we have to fight this deadly disease. This number demonstrates the headwinds we are facing in the fight against malaria, but it isn't all doom and gloom. What this does mean is that countries are finding it harder to protect people from malaria due to a complex series of challenges, including resistance to the drugs that we use to treat malaria and severe weather events that create much more hospitable environments for mosquitoes and difficulty for us, PMI, and our partners to use the preventative mechanisms and preventative tools that we usually use to protect people against malaria. In the face of these challenges, PMI and our partners are using the right tools in the right places at the right time to really tailor our response to every country's individual needs. We are innovating every single day to draw maximum impact from the malaria prevention and control tools that we have available to us. Thanks in large part to PMI, death rates fell from malaria in PMI partner countries in 2022. While every death from malaria is a tragedy, we welcome this reduction in death rate, and it really demonstrates the determination of our partner countries to protect people from malaria, even in the toughest circumstances. What makes these sites so important? Malaria is not the same everywhere. Mosquito behaviors are actively changing. Some bite at night, some are biting increasingly during the day. And we are also seeing evolving insecticide and drug resistance. It's important to identify the most effective mix of interventions for each setting, which is where these monitoring sites really shine and come into play. Some of these sites help us understand which insecticides are most effective for killing mosquitoes in a given setting and how these mosquitoes are behaving, such as whether they're biting during the day or at night. These help us make sure that we are using the most appropriate tools to protect people from malaria. For example, last year PMI supported Côte d'Ivoire in gathering and analyzing data that revealed the number of health districts that we are facing insecticide resistance, which really tripled since 2019. And now we're supporting changes to ensure that people are getting the nets that really can provide them with the most protection. These monitoring sites are absolutely critical for supporting healthy and thriving communities.